Hi guys, welcome to the Viewpoint Addiction and Lifestyle Discussion Group. Today with me I have my colleagues Johan, the coach at Viewpoint Recovery Centre, and Laura, the step counselor. My name is Sarah and I'm the psychologist here. Today we'll be discussing the benefits of long-term treatment in recovery with regards to addiction. So the usual program length is 28 days, and that is because of what the standard medical aid allowance is per year. So we've been discussing for a while now about the benefits of long-term treatment, guys.
Yeah, I agree with you. 28 days. It didn't take us 28 days to get to the place where we were at when we walked through the door. And we're hoping that in 28 days we're going to change 10, 15, sometimes 30 years thought processes that have gotten us here.
Yes. I mean, if you look at it, like 28 days, basically it's enough to create some form of awareness around certain things. I mean, like there's definite kind of issues and certain things that you can look at, but if you look at long-term sustainability and reintegration, like 28 days is just not, it's just not a viable option.
So if we look at the starting point, guys, the starting point of rehabilitation is detoxification. And with each individual, it's completely different. Like the process could go from 2 days to a week.
Yes.
And so that's already taking a week away from the actual process where the awareness happens.
Exactly.
So then you're looking at 21 days. Also, the crisis, chaos and conflict that one is coming out of when they come into rehabilitation is so close to them, if it's just 28 days, that you don't have time to recover from that, and all that's happening with the addict is wanting to fix the problem, not wanting to look at the behaviors that have caused the problem.
Exactly. Even the system that they come from, whether it's coming from the work system or the family system, like a 28-day kind of interval and intervention, it's not really a sustainable look at the system and how can you benefit the system and the person coming back into that, whichever system it might be.
Also taking into consideration if the client doesn't really want to be here, they don't believe that they have a problem, we still have to get through the muck and mire of that before we can even begin to touch sides on the issues that we have to be dealt with. So.
And then us knowing that relapse is always possible is also something that you need to look at, because an addict that has been in and out of treatment centers for years needs a longer period of time to be able to take a whole holistic look at what hasn't worked to be able to find what does work. And then I think a question that you need to ask yourself when you come into recovery is, did I put a limit on the time that I said I would use for? Because the years just roll by, and then the first time I picked up was yesterday, and I'm sitting 15 years later with my life in complete shambles around my feet. And the next one is, when I was missioning to score and creating all of this chaos, did I say that I would put the same effort into my recovery?
Also looking at the holistic program that we offer, over 28 days, there's only so much we can do. And in reality, it's 17 working days that we have to work with you.
That is true.
Because the rest of the time it's weekends, you have family. So you're asking us to undo 15 years in 17 days.
Exactly. And then the family and the people also just kind of expect that they come in and after 28 days they fix it. It's almost like there's a stamp of approval as they leave. And then when the person falls back into old behavior cycles and those kinds of things, they lose faith within the system, and they lose faith that this is ever going to be solved because they don't give it enough time.
Of course. And then also the intense therapy that needs to be done within these 17 days is full of a shock factor. And let's be realistic, guys. When you go home, the shock factor is gone. And you cannot apply what you've learned into a realistic environment, which creates this false belief system that, hey, it just fizzles out, it doesn't work. So why should I even try the small things? And that's why people that stay in treatment for 28 days most of the time come back.
That's right. And again, there's the families to take into consideration. They're all coming in here with so much baggage to get past the baggage. And sometimes you find that we're only touching sides and it's time for you to leave.
Yeah, you've just scratched the surface of all the kind of stuff that's there, and it's not really. I don't really think that it's also for an individual, yes, you want to go on with your life and you want to continue your life because of what you've done. But you also don't look at the reality of it and say that, listen, yeah, I need to not fix,
Yes.
I need to resolve what is wrong with me. And resolving stuff isn't about a quick fix.
Yes.
Resolving stuff is really looking at every single aspect of it. And so it's also unfair on yourself to expect that 28 days is going to be enough. It's pressure and stress you don't need to put on yourself.
After our entire lifestyle or a lifetime of believing in instant gratification, then you come into your recovery believing that there's instant gratification, but you get people that work our program that need to be in it for 5, 10, 15 years to find
That's true.
a place that fits.
That's true. I like what you said as well about quick fix. Active addiction was a perceived
Quick fix. Yes, and look how long you stayed in that
That's
quick
right.
fix.
That's
Like
right.
every day was a quick fix.
That's right.
Okay. So we hope that you guys have learned something from this, and we look forward to seeing